If your C-section scar shelf isn't changing, no matter how much core work you do, you're probably strengthening the wrong thing. Before we talk about exercise, we have to talk about breathing. You've probably been doing all of the ab exercises and massaging your scar, trying to squeeze tighter, brace more, do more. And you've been trying to figure out how to activate your core to finally feel like your abdomen is yours again. But no matter what you do, your abdomen isn't changing and that shelf continues to persist. Here is what you need to know. Your inner core is made up of 4 key muscles. The first being the breathing diaphragm that lives in the rib cage, the pelvic floor that lives in the base of our pelvis, a muscle called the transverse abdominis that wraps from your back all the way around to the front, and these little muscles that run up and down our spine called the multifidi. Now, the gateway to access this core is actually through the breathing diaphragm, not through your abdominal wall muscles, which most people start with. Now, in pregnancy, how we stand and hold our body and our growing baby belly affects how that breathing diaphragm functions. We start to get this kind of posture shift that disconnects our breathing diaphragm to the rest of our core. In postpartum, that posture tends to stick, and we have a really hard time regaining mobility of our diaphragm. And if we don't start here to learn how to rebalance and regain function within the breathing diaphragm, we're never going to see progress with the rest of our core. What I see most often is 2 different breathing dysfunctions. What I see most often is an upper chest breath. So as we inhale, we breathe up into our chest and we breathe down. I see this a lot with women in standing and then when they are exercising actively. When we take that breath up into our chest, we don't get the descension of our diaphragm, and we're actually utilizing what we call our accessory breathing muscles, which isn't helping us activate that breathing diaphragm to connect down into that inner core. Now, the second is belly breathing. A lot of women think of diaphragmatic breathing as just belly breathing, and so they push air down into your abdomen while they're exercising, while they're trying to do their breathing exercises. And this puts downward pressure into that abdomen and actually creates a worse mama belly pooch, which is the opposite of what we're looking for. So what does a balanced diaphragmatic breath look like? I like to call it a 360 breath. So we have to think that our breathing diaphragm lives within our rib cage. And as we inhale, that diaphragm needs to descend lower. In doing so, we get this beautiful excursion of our rib cage. And so we need to cue our rib cage to move out to the side and front and back in a 360 direction movement. We want that breath to flow into our rib cage, down into the belly and down into the pelvic floor. This is going to connect us with all 4 pieces of that inner core. Now, what I want you to do is start to pay attention about how you're breathing in daily life, not just during your workouts, but how we're caring for our kiddos, when we're lifting and carrying our babies or toddlers, how we are standing and cooking in the kitchen, or if we're lying down doing exercises. Sometimes we have one breathing pattern in one position and another in the other. And we have to think about that our daily life is most of our world, not just when we're doing exercises. So we have to change how we're breathing throughout the day and how we're accessing our core throughout the day to start to see lasting changes in that abdominal wall appearance. So remember, we want to see a 360 breath, right? So front and back, side to side, breathing down into the abdomen and pelvic floor, not up, and then not just pushing air straight into that lower abdomen. Now, once you find that balanced 360 breath, yes, we're going to need to practice it lying down in a supported position to get it before we can actually change how we're functioning and standing and with movement and with load. But I want you to remember, this isn't about lying down doing breathing exercises for forever. That's where we get stuck. This is about rebuilding the foundation so that you can train hard with a strategy that's actually going to change the appearance of your abdominal wall finally. Breathing is the gateway, but most women are using entirely the wrong core strategy. I want to show you the 3 core patterns that I see with my clients every week, and how to know which one your body is stuck in. in this next video on the screen right now. Click here to watch.